Welcome back to the Mountain Morning Show on Park City Television. I'm thrilled to be joined by our friends from the People's Health Clinic, Executive Director Beth Armstrong and Medical Director Dr. John. Good morning, everybody.
Good morning.
So I always like to start off, for people that may not be aware of what the People's Health Clinic provides, to give a little bit of an overview of the role you play in the community.
Right. Go ahead. I'd say it every
Okay, great. Well, we take care of people without health insurance who live in Summit County or Wasatch County. And we provide a real wide array of primary care and some specialty care when we have volunteers in certain specialties that come help us. So, you know, we have family doctors, internists, pediatricians, chiropractors, nutritionists, just a lot of different providers to really provide a complete primary care medical home.
And what's so wonderful is it's for the people that may not be able to experience this without insurance, that they may not have the access, and you all provide it relatively free of charge. It's donation based, right? It's what you can afford to contribute.
Right. We don't charge anybody, but we ask all of our patients to make a small contribution, and 90+% do that, which is great. Sometimes they can and sometimes they can't, and that's fine with us. But we've worked really hard over many years to make the People's Health Clinic the same quality of care that I've given in any other clinic I've worked in over the years.
Well, and the facility itself, I mean, I've been over there, and since the renovation, it's absolutely gorgeous.
It really
I mean,
is.
it looks like at the top of the line medical office. This is not what people think of in terms of, oh, it's a free clinic. I mean, this is a gorgeous facility with the same medical care and doctors that are seen in a lot of our other community facilities that you know, donate their own time to this.
That's right. That's right. It's the nicest physical plant I've ever worked in. You know, I don't know if that's saying anything good or not, but yeah, we really have Park City Medical Center and the IHC system and Summit County to thank for that facility, and then some really generous donors who allowed us to buy top of the line furnishings and equipment to go into the building.
And medical equipment.
Right.
And this isn't just you know, reactive medical care. You're now starting to offer really proactive screenings and tests and things, so people can really take ownership of their own well-being.
Absolutely, and of course that's a huge issue in healthcare today, is people who either don't have easy access to care or feel like they can't afford it wind up just getting sicker and sicker and going to the emergency room, where it costs them thousands and thousands of dollars, which often they can't pay, and so the system, you and I and everyone else who does pay insurance, kind of has to pick up the slack for that. So what we do is we provide preventive care in all ways, you know, mammograms, women's health screenings, colon cancer screenings.
You're also now doing diabetes, pre-diabetes screenings as well.
Right, so we also have community outreach days, several every year in multiple areas in both counties, and we do screenings for diabetes and for high cholesterol and for high blood pressure, and then anyone who, you know, raises a red flag is referred to the clinic where they're taken care of.
That's fantastic.
Yeah.
And what would you say is the most prevalent reason people come into the clinic that you just sort of see the most of?
It's all over. Well, prenatal, obviously.
Yeah, we have one day dedicated to our prenatal patients, which is a phenomenal resource here. If you can imagine being pregnant and not being able to get care.
No, exactly. No, I can't. I mean, honestly, I mean, it's beyond yourself.
Right. So you show up in the emergency room in labor, and nobody knows anything about your history, about your pregnancy, and
it's not an intimidating enough experience.
Right.
You have to go into it blind.
And of course, the risks in that case are dramatically higher. The risk of a low birth weight baby, of a poor outcome, and so providing prenatal care and ultrasounds and, you know, just great screenings is really a lifesaver for both the moms and the babies.
It's taking care of our youngest community members that are yet to be.
Our most vulnerable.
And our most vulnerable.
We see a mix also. We see a lot of pediatric well visits. We see a fair number of pediatric sick visits. We see a lot of adults with chronic disease like diabetes and high blood pressure and high cholesterol. It's really a wide range. It's really like any other primary care clinic, with the exception, I think, that we also see a high level of acuity in a lot of cases, because people, let's say, with severe rheumatoid arthritis that I normally would refer out to a rheumatologist, at least once a year to get, a plan in place. We may not have that opportunity, and our patients may not have that opportunity, and so we wind up taking care of them.
Filling that
Right,
void.
right.
So with Live PC, Give PC coming up this weekend, we've been featuring so many different nonprofits on the show, and I really can't think of one more valuable than taking care of the well-being of our fellow community members.
That's
But if you, when people are thinking about where to donate, where will that money go in the People's Health Clinic?
Right.
Where is it mostly
Do you wanna answer
sort
or
of
want me to?
filtered?
Go ahead.
I was going to say, Beth,
'Cause
you're
I
the
wanna
executive
go-
director of
I
Dr.
wanna
John.
go right to, really, it goes right to programs, right? It goes right to taking care of people. We have a very lean budget. We are really good stewards. We have a phenomenal board. But what's really, what really makes a difference is that we have many dozens of volunteers who come help us. And so the money that we receive as donations is leveraged 3, 4, 5, 10-fold by those volunteers. We have a retired neurosurgeon who comes and sees patients at our clinic. We have a retired orthopedic surgeon who
Only in
comes.
Park City.
I know.
Which you-
We have
the greatest doctors in the world.
a world-renowned ophthalmologist from the Moran Eye Center who comes and sees patients at our clinic. All as volunteers, all giving their time. And so, our staffing needs are dramatically less because of that. So the money actually goes, right to taking care of people.
I can't think of a better place for it to go.
Thank you.
All right, so it's Live PC, Give PC on November 4th, and if you want to put your money where your heart is, I can't think of a better organization than the People's Health Clinic. Beth, Dr. John, thank you so much for being
Thanks
here
very
this
much,
Thank
morning.
you very much for that.
All right, and we will be back on the Mountain Morning Show with much more right after this.